One of the most common infant-related 911 calls is for choking. We all know babies love to put everything in their mouth. It's how they explore their world. Unfortunately, that can often lead to tragedy. As we've all heard, an ounce of prevention is worth more than a pound of cure. With that in mind, only give foods that are age-appropriate. Closely monitor infant feeding. Avoid giving access to objects small enough to fit through a roll of toilet paper. However, even the most cautious parent or childcare provider can find themselves with a choking infant, and it's important that we know how to recognize it.
With a mild airway obstruction, the infant will be coughing forcefully. Do not interfere. Continue observing the infant as this may progress to a severe obstruction. A choking infant is unable to give the universal sign of choking, so you should look and listen for an inability to breathe, make sounds or cry, a weak, ineffective cough, turning blue around the lips and face, and bulging or tearing eyes. If this occurs, it's time to act. To remove the obstruction, hold the infant face down, with the head slightly lower than the chest. Support the infant's head by firmly grasping the jaw, but not the throat. Support the infant on your thigh, like this. Now deliver 5 firm back blows with the heel of your hand in the middle of the back between the shoulder blades. Use enough force to dislodge the obstruction. 1, 2, 3, 4, 5.
Couldn't that hurt my baby?
Sure, a minor injury may occur, but saving its life is more important. After 5 back blows, place your free hand on the back of the baby's head and sandwich the baby between your arms. While carefully supporting the head and neck, turn the infant face up, resting on your forearm. Use 2 fingers to give 5 sharp downward chest thrusts in the same location as in CPR, but with the intent to dislodge the object. 1, 2, 3, 4, 5. While keeping the head low, continue alternating this sequence of 5 back blows, 1, 2, 3, 4, 5, and 5 chest thrusts, 1, 2, 3, 4, 5, until the object is dislodged and the baby cries, or until the baby becomes unresponsive. The unresponsive baby will look just like it's sleeping. There's no crying or struggling for breath, and it's limp. Now place the baby down on a firm, flat surface and begin the ABCs of CPR. Perform CPR with the added step of briefly looking in the mouth for the object before each set of breaths. After 5 cycles of CPR, call 911 if not previously done, and resume CPR.